All right, class. So we finished talking about our macromolecules. So now I want to talk about the different problems that can arise when your body's not taking in these macromolecules and it's not digesting them properly. So the first type of disease that we're going to go into is called diabetes. The official name diabetes mellitus, and we're going to talk about its history. There's two different types, type 1 and 2. And we're not going to really go too far into the symptoms and treatment because it can get a little complicated. Remember, this is just an introduction. So, history. As you can see from the slide, just reading along. Before insulin was discovered in 1921, diabetes type 1 was a fatal disease. Most patients would die within a few years of onset. Medical and technical advances have changed the outcome of many diabetics, and people who have been diagnosed with diabetes can now live a normal life, right? So, what do I mean by normal? They're not dying sooner. They can live to the age of like 60 to 70. So we see this word here, insulin, okay? And what I want you to know about insulin is that it's a protein. And if you can remember about our discussion of proteins, proteins are made up of amino acids, right? So amino acids would be the monomer, and proteins would be the polymer. All right, we use dehydration synthesis to link them together. Just a little recap. Now, where is insulin made? So insulin is a hormone produced in the pancreas. We'll stop there. Hormone. Could be a new word for some of us. Others might know what a hormone is. But what you really need to understand about a hormone is that it's a chemical messenger. Now, what do I mean? Our cell is made up of our body is made up of trillions of different cells. And these cells need to be able to talk to each other. So what we do is we use something called a chemical messenger. There's different forms, but the hormones are specific for something called the endocrine system. Now, much like your other body systems, such as your skeletal system or your circulatory system, it's made up of different organs. The chief organ in the case of insulin is the pancreas. When you look at this little schematic over here, you see our stomach. Now, the way the stomach works is that food will enter the stomach. In the stomach, it'll meet acid, which will help to break it down. What your stomach also does is it churns, it moves around. You can hear this when you're hungry. The sound of churning stomach when you're hungry is a result of it moving around just air. There's no food in there for it to break down. So food is broken down through two methods. One is by chemical, using acid, and the other one is by mechanical, using churning. The pancreas is this weird little organ right underneath, tucked into the stomach. Now, as you can see here, insulin has something to do with how diabetes is formed. And what you basically have to understand about this is that insulin allows glucose or sugar to leave the blood and enter the cell. So, you initially have food. Once it's in the stomach, it's broken down into simple substances such as sugar. But the sugar is located in the blood. Once it's broken down into the stomach, all the nutrients that are important are shuttled into the blood. We need to get the blood into the cell. And the way we do that is by using insulin. So, let's talk about the difference between type 1 and type 2 diabetes. Now, I'm going to take it slow here because I can understand this could be a little difficult to understand. In order for you to understand how diabetes works, we're going to use the following analogy. We have the door, which represents the cell wall, okay, or the cell membrane. But either way, it's the outside of the cell. Things that are on the outside of the cell have not yet entered the cell. The person that you see standing here could be represented as sugar. We have a key, which is equal to insulin, and the key lock, which is the receptor site. We have the hallway, which is the blood vessel, and we have the door itself. Okay, so let's look at what each one of these represents. It's a little hard to read, but the hallway represents the blood vessel, okay? So all of this right here is the blood vessels. The door is the entrance to the cell. So remember I said that outside the cell, things haven't entered it yet, right? The door is that way of things getting into the cell. The keyhole is the cell wall receptor site. So basically, the key is what opens up the cell for things to get inside. And that key in this case is insulin. Now, the important part is that the person in the hole represents sugar that builds up within the cell. Okay? So, when the door isn't open, sugar lines up in the hallway. That's the way to think about it. Let's talk about type 1 diabetes first. In type 1 diabetes, we call this one the juvenile insulin-dependent diabetes. Now, what does it mean, juvenile? It means children or adolescents. So type 1 diabetes is usually diagnosed in children. Here's our analogy over here. The door, the individual, the key, the keyhole, and the hallway. In the case of type 1 diabetes, the person with diabetes does not produce keys, okay? Or if it does produce keys, it doesn't produce enough keys. Each cell has a door on the outside. Each door needs an insulin key. If I don't have enough insulin keys, I can't open all the doors, and as a result, I'm going to have people standing in the hallway. And what does this represent? It represents sugar building up in the blood vessel. So now sugar is being concentrated in the blood. That's type 1 diabetes. Again, it's because we're not producing enough insulin. Type 2 diabetes is called adult onset diabetes. It's also called obesity-related diabetes. This one is known as insulin independent, which means insulin doesn't really have much of a factor in playing a role in why this diabetes is caused. So, in this case, weight issues leads to the diabetic having keyholes that don't really work. So it's not really a problem with the insulin or how much insulin you're producing. Something's changing with the keyhole, okay, with the shape of the keyhole, so that the keys aren't fitting. Obviously, if the keys don't fit, the door can't open, and you're going to have individuals in the hallway again, right? Which is representing sugar backing up into the blood vessel. In each case of type 1 and type 2 diabetes, what you're seeing is that blood is being, held inside the blood vessel. So what are some of the symptoms? One of the symptoms of diabetes is hyperglycemia. Okay. Now, I don't want people to get confused. This is usually associated with type 1 diabetes. Okay. The most common symptom of type 1 diabetes is frequent urination. These individuals have to use the bathroom often. And there is a reason for this. It's a little bit complicated, but trying to make it as simple as possible. People need to urinate when their body is full of liquids. And the way your body tells us is through an organ called the kidney. And what the kidney does is it takes a look at your blood. It takes a look at all the stuff in your blood. And basically it kind of weighs it. And if the weight of the liquid part of the blood is heavy, it tells your brain that you need to use the bathroom. In the case of diabetes, because your blood is filled of sugar, it becomes heavier and it tells your body all the time that it needs to use the bathroom. This is also complicated by the fact that people have excessive thirst. Again, this is another mechanism of your body. What your brain tells your body when you have a heavy weight to your blood is that you need to drink more. The body thinks that by taking in more water, you're going to dilute the blood, which means make it thinner. Hyperglycemia could also cause increased hunger, as shown by the picture here with this man eating a lot. However, despite the fact that it has increased hunger, what you actually see here is weight loss. So an individual might eat more, but they'll be losing weight while they eat. Another common symptom, tiredness. Okay, people with hyperglycemia are often tired. We're going to put that together later on. You also see a lack of interest and concentration, blurred vision, okay, and some other minor ones. Now, it's important to know that these are the common symptoms. There are other symptoms, but they're not called common symptoms because they may not show up in every individual. But that's just hyperglycemia in a nutshell. Let's look at hypoglycemia. hypoglycemia. Again, this one means low blood sugar. This one is more associated with type 2 diabetes. In this case, what you see with hypoglycemia, the common symptoms, anxiety, depression, moodiness, okay? Now, you might think to yourself, these are all factors of emotion. How could that be if it's only about sugar? Your brain is actually one of the organs that uses the most sugar in your whole body. It constantly needs sugar to be functioning. When your body's not getting enough sugar, you'll notice a change in your thinking and a change in your mood, okay? Some other symptoms, palpitations, and this thing called tachycardia. So they're exclusively referring to the heart in this case, okay? Your heart is supposed to have a steady beat. It's called the lub-dub beat. Lub-dub, okay? The first beat contracts, the second beat releases, okay? Tachycardia is a situation where your heart beats too fast, okay? This could lead to a heart attack. Another common one, feeling hot and sweating. Another common problem with hypoglycemia. As mentioned again with the brain, could also lead to seizures. And some final, less common ones, which is confusion, dizziness, poor coordination, and slurred speech, okay? So they're not really pronouncing their words sound all fuddled together. And a tingling sensation and the numbness in the hands or feet. So this is a symptom that's shared between hyperglycemia and hypoglycemia. The worst case scenario is going to be the coma. Okay, so again, affects the brain, and if the brain goes a long period of time without sugar or too much sugar, it'll actually shut down. I do want to go over this a little bit. Why specifically the hands and feet? Your hands and feet are part of your body called the extremities. It means they're the farthest away from your heart. Your body needs to do the most, it needs to provide the most energy to push blood to your hands and your feet. If that blood is thick and sluggish, it's not going to go to your hands and feet quickly, and it's going to lead to oxygen deprivation in those areas, which represents the tingling sensation or numbness. So, how do we treat individuals with diabetes? Typically, we use this 5-step plan here. Part of it is self-monitoring. Another part is food planning with a dietitian. Exercise, also usually through a dietitian. Some individuals, usually type 1, will have to take insulin, okay? And a new technology is called the insulin pump, where you don't even have to do it yourself, a machine does it for you. Again, we're not gonna dive too far into this. But I do wanna talk a little bit about self-monitoring. With a diabetic, after you eat, or if you don't eat quick enough, your body has fluctuation in the blood glucose level. So the amount of glucose that's in your blood changes quickly. As a result, individuals need to test themselves constantly. The way they do this is by first drawing some blood. They prick their fingers with this device called a lancet. This will usually, cause like a drop or two of blood to come out, which is then picked up by something called a glucose scan or a glucometer. And this will give you a reading of how much glucose is in a certain amount of your blood. Food planning really refers to monitoring how much food you're eating and what type of food you're eating. The plate method focuses on filling the plate with non-starchy vegetables. Remember, again, starch means glucose, right? If you have a problem with your insulin or opening that door to get sugar into the cell, you probably want to watch how much glucose you're eating and those foods that have a lot of glucose in it. The most popular one is called carbohydrate counting. So people with diabetes are often monitoring how much carbs they're eating and in what quantity. Again, because carbs are what breaks down into glucose, and that's what drives your blood glucose level. The last one is called the glycemic index, which is a little bit unpopular because not a lot of people know about it, but that's monitoring to see the type of food and how it affects your blood glucose level. People with diabetes are encouraged to eat items such as this: vegetables, whole grains, fruits, non-fat dairy products, beans, lean meats, poultry, and fish. You'll notice that on here, you don't see the presence of foods such as bread, rice, things like that. In fact, they make an emphasis to say whole grains, because whole grains are typically low in sugar and high in fiber. Now, in type 1 diabetes, because their body's not making enough, obviously the treatment is to put more insulin in the body. This is in the form of these injections. These are insulin injections. Okay, you don't necessarily need to read the instructions. I mean, you can if you're interested, but essentially what you're doing is you're taking this artificial insulin and you're pushing it into your body. Nowadays, however, people don't even need to do that. They have these things called insulin pumps where it'll inject throughout the day insulin straight into your bloodstream based on this device, which does a constant reading of your blood glucose levels. Now, as I mentioned before, taking insulin is mostly the treatment for type 1 diabetes. People with type 2 diabetes, doesn't matter how much insulin they take. It's not a problem with the insulin. It's a problem with the mechanism that gets the insulin to open the door, to open the cell for more glucose to come in. So you'll see the treatment for type 2 diabetes is really entirely dependent upon dieting. Okay, so they'll emphasize that people with type 2 diabetes need to focus on weight control and doing more physical activity. When your weight drops, the decrease in weight changes back the shape of the keyhole. So this type of diabetes is also known as reversible. Okay, you could technically treat it and it'll be fine. That's all we're going to get into today for diabetes. We have some other assignments planned out for today, but I do have an exit ticket that I want you guys to take a look at. It's attached to this video. Simple questions, but I want you guys to go over the PowerPoint, take a look at it, and pretty much outline what you've learned, what the difference between type 1 and type 2 is, and any questions that you may still have or anything that this PowerPoint cleared up for you. As always, I'm available through video conference or through Google Classroom to help you guys with any questions you might have. And we're still going to do our Friday meetings just to catch up, okay, and make sure everybody's doing well and staying sane during the lockdown and the quarantine. Still miss you guys and hope everyone's doing all right. And I'll see you later.